This is the seventh module in a series of videos about the business of the eyecare service. Module 7: Financial Considerations in the Eyecare Service. The learning objectives for this module are to understand how income generation leads to financial sustainability, to understand basic business economic terms and concepts relevant to the eyecare service, understanding multi-tiered pricing policy, to define and understand compassionate capitalism, and to learn cost considerations for outreach. Reaching the unreached with high quality eye care costs money. Eye care services can be financed by fundraising, such as through charitable donations and grants, or income generation through social enterprise and fee-based services. The most sustainable programs rely on their own cost recovery and income generation rather than charity donations. By charging appropriate fees to patients who can afford eye care, that is glasses, it is possible to generate enough income to cover the majority of community outreach expenses and to treat an equally large volume of patients at low cost or free. Charitable funds play an important role in covering the start-up costs of eye care institutions in developing countries, but the independence and capacity building that comes with income generation maximizes charitable donations and impresses donors, which can lead to further donations and philanthropic investments in the future. Outreach programs can generate actual income for the eye care institution when publicity for outreach events attracts some paying patients to the vision centre directly. Outreach events always create a buzz in their community that leads to some paying patients. While several other ways to attract revenues can be implemented, a multi-tiered fee-for-service approach remains the most common form of income generation for eye care institutions in developing nations. It is important to understand some of the definitions around financial considerations in the eye care service. These include case finding cost, or per unit cost, is how much money is spent to get one patient. Cost containment, simply defined, means less money going out. It is the process of controlling costs and keeping expenses to the minimum without sacrificing the quality of service or product. Cost recovery means enough money is coming in to recoup all the costs associated with running an institution or a program within it. Cost effectiveness means producing good results for the amount of money spent. Cost of service provision is the total cost of eye care for one patient, covering all the expenses of providing the service. And financial sustainability means that income generated covers or exceeds costs over the long term. Self-sufficiency means generating at least 100% of the expenses through income of all sorts. Generating more than 100% gives the eye care institution extra funds for growth and development. Income generation is any attempt by an eye care institution to cover part or all of its costs through the earned income of its products and services through social enterprise. Cost containment, cost recovery, and income generation rely on a clear understanding of the cost per unit, in this case, the cost per eye test and glasses. Capital cost is the cost of land, building, major equipment, etc. Fixed costs are costs that have to be incurred regardless of the number of patients or level of activity, for example, salaries, interest, depreciation, overheads, electricity, water, annual maintenance contracts, etc. And cost recovery is calculated as a ratio of income divided by expenditure and is expressed as a percentage. Variable costs are costs that vary directly with the level of activity. For example, cost of frames, lenses, medicines, transport to outreach and back, etc. Unit cost is derived by dividing fixed costs, apportioned to that activity, by the number of units plus the cost of consumables per unit. Unless a patient walks in off the street, there will be costs associated with attracting patients to an eye care institution. Without tracking all the costs of case finding, it is difficult to know how to budget and impossible to gain a complete picture of the institution's financial situation. So we must be aware of the cost of human resources for planning and organising outreach, the costs of determining outreach sites, of identifying community partners or sponsors, and of arranging and confirming the outreach venue. The cost of publicity materials to make local people aware of the eye care service. We also need to know outreach team accommodation and food expenses and factor in the team's transport to the venue and back. Also, the fuel and vehicle expenses, such as maintenance for both trips, the cost of clinical supplies for screening and diagnosis, the cost of support services and facilities, such as water and power supply, furniture, toilet facilities, and a generator, and the expenses of volunteers who assist with the publicity campaign and event management activities, for example, their food. When it comes to containing costs, we are looking at managing seasonal variations. Also, recognizing that the higher the attendance, the lower the cost per patient. We should be developing in-house competence for instruments and equipment maintenance. We certainly should be regularly reviewing cost data and systems, such as daily and monthly review of revenues and expenditures. We must control expenses through formal procedures for approval and undergo an independent audit of all internal records. When considering cost recovery, we need to understand that high quality plus large volume eye care allows pricing of glasses that the majority of a local population can afford. We want to increase the volume of patients tested whilst maintaining quality. The more patients an eye care professional sees, the more rapid and skilled they will become. And we should engage other people to perform less skilled tasks, such as measuring vision and administration, to allow eye care professionals to maximise the number of eye tests and glasses dispensed. Collaboration, empowerment, and ownership are essential if we are to achieve maximum success in our eye care service. There needs to be a desire to break the reliance on non-government organisation donations to sustain the eye care service and a desire to achieve self-sustainability. We might ask ourselves, what are the existing incentives for excellence? How can new motivating forces be built in? What motivates staff to deliver high quality and large volume services? Are staff involved in designing the organisation's action plans? Are staff personally committed to making the eye care service self-sustaining? By targeting patients' capacity to pay for eye care, it is possible to cover not only the costs of eye care, but also to subsidise community outreach in poor areas. Determine what percentage of patients can pay above cost, around cost, below cost, and not at all, in order to set the fees you will charge each group, so that the programme is completely, or almost completely, self-sustaining financially. The goal is that there is enough of a paying clientele visiting the vision centre to generate sufficient revenues to cover operating costs and to finance community outreach. Compassionate capitalism rests on the principle of generating sufficient profit to deliver services to underserved or poor people. It is not based on maximising profit at all costs, at the expense of excluding people with low purchasing power, for instance, those who cannot pay above cost. Staff are motivated by the reward that comes from establishing and being part of a self-sustaining eye care institution that offers high quality services to a high volume of patients and reaches out to the poorest members of society. Compassionate capitalism means charging the lowest possible amount of money needed to become self-sufficient, while continuing to develop and maximise the delivered quantity of affordable eye care services, not just charging what the market will bear. It means choosing to use profit margins and surplus revenue to deliver services to poor people at a low fee or for free. And it means managing finances properly through cost containment in order to generate excess revenues and then utilise that money to subsidise low paying work. Overall, we want to be pricing our services and products so that they are affordable to the targeted markets by developing a social, marketing-based community vision centre service and outreach. We are talking here about a different approach to eye care than the low volume, low revenue model. High volume service delivery in large, low income markets leads to an increase in revenues. At this level, market perceptions change and a growing reputation generates demand. This then means that accountability to patients and patient satisfaction, whether patients are free or paying, is important and it helps business thrive. Furthermore, requiring patients to pay a fee for their products, in our case glasses, increases their involvement in their health care, so everything moves in an upward spiral of growing reputation, higher numbers, increased revenue, increased services to the poor, higher quality service, and community ownership of their eye health. Adapting to changing patient expectations is an opportunity to become the market benchmark for high quality, reasonably priced eye care. Patient expectations have two dimensions: quality of clinical outcomes and quality of non-clinical care. For example, courtesy and respect, communications, cleanliness, a well-organised facility. We must be aware of these expectations and provide a service that meets and exceeds them for each patient. As a rule, high costs per unit reflect a low volume of patients, lack of demand for services, and possibly low quality of eye care outcomes. To bring down per unit costs, ensure high quality visual outcomes to attract a higher demand for services, and manage staff and resources in ways that save time and money. Cost containment plays a role in cost recovery. And remember, fixed costs are spread over the number of patients seen, so the unit cost per patient decreases with increasing volume. When considering factors influencing the cost of outreach, we start by thinking about systematic planning. Selection of the village, date and venue, calculation of geographic information such as area of coverage and population, estimation of outpatients for screening, and previous experience in that district are the major factors that must be researched and planned systematically. Any one of these factors can influence the outcome of the event and the cost of the event directly. A publicity campaign must be planned scientifically and executed effectively in order to reach the targeted population for each outreach event. Based on the geographic information collected in the systematic planning stage, a publicity plan should be made with details of date and approximate duration of publicity in nearby villages. Include a route map and schedule for distribution of publicity materials. It is important to have audio announcements, since the target audience is often one that is visually impaired, with very simple, clear and audible content. Audio announcing should be done in places where people gather together. In other words, the announcer should stop where there is a crowd, deliver the message, and then move on. We should make use of the most cost-effective methods of mobilisation. Some examples would be posting details of the outreach event in health centres, putting up display boards in markets in nearby villages, contact religious or spiritual leaders to pass on the message during prayers and religious services, training a group of volunteers to go to villages to identify needy people and guide them to attend. We can involve local key people and communicating the availability of glasses at lower prices. If an outreach event is not productive, the per unit cost of case finding goes up significantly. The productivity of an outreach event has to be the focus from the planning stage right through to the utilisation of resources. And finally, budgeting and cost control are very important for operating outreach programmes in a sustainable manner. That concludes Module 7 on financial considerations in the eyecare service. Coming next will be Module 8, Challenges in Providing a Sustainable Eyecare Service.